Because there was no evidence that the nurse called Dr. Hughes about the patient's complaint, the issue of abandonment of YW over the weekend after her surgery was not supported by clear and convincing evidence to a reasonable certainty. That's what the judge found. In this case, our own expert testified that a doctor could not be held responsible under circumstances where news of his patient's declining condition was not relayed to him. Notably, the ALJ, after hearing this testimony, found that the standard of care for this operation used by our expert, who condemned it, and upon which the board relied in filing its charges, came into being in 2018, 3 years after the 2015 surgery on this patient. As noted in his proposed decision, he also found that the testimony of 2 defense experts plus Dr. Hughes was persuasive evidence that plastic surgeons commonly performed deeper fat injections in 2015 at the time of TW's surgery before discovery of the alarming risks of mortality from fat emboli correlated with intramuscular fat injection. Given this testimony, the judge wrote, the overall evidence did not establish the standard of care departure in TW's surgery that Dr. Stone, our expert, described. Our expert's opinion, however, was changed when confronted with later produced defense evidence in the form of Defense Exhibit QQQ, which was not produced in the investigation nor seen by our expert when he formed his opinions. The board had one expert who unfortunately applied the wrong standard of care for patient TW and was confronted with additional evidence of informed consent unknown to the board for patient NL. So despite our displeasure with how things unfolded, on balance and in fairness, the ALJ's factual findings underlying his decision to dismiss the accusation are supported by the evidence, and it is the Attorney General's position that due to the conflicting expert opinions, the evolving standard of care, and the previously undiscovered evidence that was presented at the hearing, coupled with the ALJ's evidentiary rulings and credibility findings modifying the decision for any reason, including public safety, would be difficult to sustain on judicial review.
In this case, the expert was, in our view, both corrupt but also lied profusely in this case, and we don't know why. One of the things the expert argued initially was that we had not filed the death or transfer report that is sent to the board. And it's in part because it wasn't found in the patient's records, which are maintained by the competitor physician, not by Dr. Hughes. We asked the board to look itself, and indeed they found that the documents had been filed. The expert did not take up the simple requirement of calling the board to see if those documents were on file before he opined that it was an extreme departure not to have filed them. This expert revised his opinions 5 times throughout the course of the case. Every time we read his opinion, we responded with how he was factually incorrect, and he backed down each of those times. At some point, we believed that the board should have taken action to stop this case. We believe that the Attorney General, who was given the information, passed them on because we know the deputy, he's an honorable person, and he indicated he had. We are concerned that this was not stopped early enough to prevent the kinds of harm that we all know happen to physicians when the accusation goes up on the website. And you can't watch the other experts show how what the board's expert, Dr. Stone, said was physically impossible as a matter of anatomy. It's very hard to understand how this case got as far as it did, but somebody should have stepped in on this case and made it stop before all the harm that happens to any physician happens when their name goes up on a website accusing them of killing patients.